Tracheal, bronchial and lung cancer. Number 5. Respiratory tract cancers include cancers of the trachea, larynx, bronchi and lungs. The main cause is smoking, inhaling second-hand smoke and toxins from the environment. But household pollution like fuel and mold also contributes. A 2015 study reported that respiratory cancers account for about 4 million deaths annually. In the developing world, researchers predict an 81 to 100% increase in respiratory cancer rates due to pollution and smoking. Chronic obstructive pulmonary disease. Number 4. Chronic obstructive pulmonary disease, COPD, is a long-term progressive lung disease that causes difficulty breathing. Chronic bronchitis and emphysema are types of COPD. In 2004, about 64 million people worldwide were living with COPD. Risk factors for COPD include cigarette smoking or passive smoking, lung irritants such as chemical fumes, family history, with UTD gene linked to COPD, history of respiratory tract infections during childhood. There is no cure for COPD, but its progression can be slowed with medication. Lower respiratory tract infections. Number 3. Lower respiratory tract infection is an infection in the airways and lungs. Illnesses can be caused by influenza, or flu, pneumonia, bronchitis, tuberculosis. Viruses commonly cause lower respiratory tract infections. They can also be caused by bacteria. Cough is the main symptom of a lower respiratory tract infection. You may experience shortness of breath, wheezing, and a feeling of tightness in your chest. Untreated lower respiratory tract infections can lead to respiratory failure and death. Stroke. Number 2. A stroke occurs when an artery in the brain becomes blocked or leaks. This causes brain cells that are starved of oxygen to begin to die within minutes. During a stroke, you feel suddenly numb and confused or have trouble walking and seeing. If left untreated, a stroke can cause long-term disability. Risk factors for stroke include high blood pressure, family history of stroke, smoking. Ischemic heart disease, or coronary artery disease. Number 1. The deadliest disease in the world is coronary artery disease, CAD. Also known as ischemic heart disease, CAD occurs when the blood vessels that supply blood to the heart become narrowed. Untreated CAD can lead to chest pain, heart failure, and arrhythmias. Risk factors for CAD include high blood pressure, high cholesterol, smoking, family history of CAD, diabetes, being overweight. Talk to your doctor if you have one or more of these risk factors. You can prevent CAD with medication and by maintaining good heart health. Thanks for watching. Subscribe to the channel.